India is the largest country where it stands fourth in the production of the medicines. Let us see now. India has operated the public service system or the public healthcare system in a very efficient manner. India holds to be one of the largest country not only in population but provides many facilities and build many number of hospitals to cater the services to the lakhs of people who stay in the villages. Let us see the figures of which are very impressive here. See, India stands fourth in the production of the medicines. India produces large number of and variety of medicines in the world, and it's standing number 4 in the production of the medicine, which is just after the superpower nations. And moving on to the next, India has the highest number of medical colleges in the entire world. India wants to be more number of medical colleges in the world, and every year from India 15,000 doctors get qualified. This number itself, it shows that there is a high amount of doctors coming out in order to serve the people by their services. At the same time, if you see the statistics of the hospitals, in 1950 the hospitals were 2,717, while the number moved on in 1991 it was 11,174, and finally in 2000 it number went on to 18,218. Now, if you have seen the picture of the Indian global health situation, the situation is that if you look at the statistics, it feels like the effective services have been done to the people and the citizens are getting the actual benefits of the public healthcare system. No, but the actual view of the constitution reveals that every Indian should be treated equally and ensured to get the best treatment in order to have the equal sustainable growth. But in actual terms, we have the actual picture contrary to the views of the constitution. Let us analyze this with an example. Let us see with some two characteristics having the same kind of diseases, what are the situations that have met them when they approach to a private hospital and when they approach to a government hospital, and what are the different systems of healthcare are existing in India. We shall analyze now. Let us see the example. Now, moving on to the situation here, healthcare services. How are the healthcare services catered to the people of the nation? Let us see with an example. We have two students named Kiran and Sarita who study in a village called, it's a semi-village where it's Kakinada, it's now emerging as a town. In this Kakinada, we have the private hospitals as well as the public healthcare system. So when these Kiran and Sarita met with a viral fever, which they came to know later, were taken to the hospitals. Sarita's father has taken Sarita to a private hospital. So Sarita's father has taken to a private hospital where it has meant that they have to pay fees. Immediately they paid 100 rupees at the reception counter and they were asked to wait for a few minutes. Later the doctor appointment was given for them. It is just like a big 5-star hotel and everybody was greeting them with a polite manner, and she was waiting there. Then she got the appointment of the doctor. Then the doctor came, asked to have some prescribed tests. Then after the tests are done, then again the report was analyzed by the doctor, and finally the output was given that she is being suffered with a viral fever and nothing to bother much. He has prescribed some medicines and she started to utilize them, and finally she has been recovered after 3 days. This is a treatment which is meant, like she spent only 1 hour in the hospital and later she was asked to take care at home. And moving on to the case of Kiran. Kiran's parents were not so sound enough, so they have approached to a public healthcare system where everything is owned and run by the government. He has to stand in line for hours in the queue, and after standing in for hours in a queue, he was asked to get some kind of medical tests which are required for them. After the tests were done, again the next day they have to go, they have to collect the reports, and then it was finalized that he is suffering from some kind of viral fevers. Then again some prescribed medicines are given, and only for the tests he has to pay some 100 rupees of amount, and finally after a week he has recovered himself. And finally when Kiran and Sarita met again in the school, they started to share their experiences of what happened for them in the previous week. As both of them were absent, both of them were discussing like what happened in the previous week. Then they made a statements that they went to hospitals in order to get treatment for the private hospital, for the viral fevers. And the situation went on in such a way that finally the question rises, how much did Kiran pay, how much did Sarita pay? The answer is that Kiran has to pay rupees 100 while Sarita has to pay rupees 3,500. Kiran has to pay 100 rupees. And moving on to the situation now, why the quality of medicinal treatment has become so costly and she is so comfortable that she can't even stand. It's not necessary for us to stand at all. Everything was done in the same day. They were approached in a holistic manner. Everybody is respecting them and the care was taken for her immediately. Whereas for Kiran, even though he paid 100 rupees, he has to stand in a long queue for hours together. Then he has to take the reports on the next day. Then he gets the final output that he is suffering from the viral fever. So what is the major difference between these two? What is the system that they have approached from? They are different from each other. We'll analyze that. From the story of comparison between Sarita and Kiran, we have seen that we have two different systems of healthcare services in India. They can be broadly divided into public healthcare services and the private health services. Let us first discuss about public health services. In public health services, every minor to the major issues, all the health related issues are solved. They are provided assistance in order to get treatment from them. At the same time, we have the ASHA workers who are working in every village. They move on to the different places, find out the actual ground scenario, the ground reality, what's happening at the grassroots level, the health conditions, drainage system, everything. They study it and they give a clear picture to the people like what should be done, what should not be done, what kind of diseases can be occurring to them. In this way, they enlighten the people of the villages. And moving on to the other one, we have the Anganwadi stations. The Anganwadi play stations are the places where the small children are provided the immunization, injections or the cylindrical things which are necessary for them at the point of time to get themselves energized. And 0 to 5 years of age, every child is to be given some immunization, MGs, polio drops, all the things, so that they can be healthy, fit and fine. This is one of the major achievement what we have achieved is the polio, eradication of polio through the giving polio drops every year without fail. And moving on to the Anganwadis are under the control of the Mandal Public Health Services. Mandal Public Health Services contain of a group of 5,000 families or people. They provide the services to all the areas of the mandals where 25 to 6 villages are covered under the mandal group. And from here 4 or 5 mandals are brought into the primary healthcare centers. The primary healthcare centers then move on to the community healthcare centers. In this way, we have the upgradation of the services provided for them. And in the community healthcare services or centers, we find a 30-bedded hospitals where every treatments are provided. So then what is the point of negativity that is bringing out the people to move on towards the private health where Sarita has been taken in the given example? So what is the private healthcare services? That we have to find out first. Public healthcare system, private healthcare system. What is the major difference between these two? We have seen the working of the public healthcare system. We have seen the systems of development through a proper channel. A minor to a major disease will be treated. The ASHA workers will be going to each and every village to get the actual ground reality. Then the Anganwadi workers, then we have the Mandal primary health centers, then we have the primary health centers, and then we have the community health services centers. In this way, how is the private centers in competition with the public service sector or the public healthcare system?